after doing some IVs, glutathione C, right? We've done that. We're going to do a little bit of stem cells or wharton jelly. It's been in clinical studies. So this is the wharton jelly. It's on dry ice. We're going to infuse that with saline. Your oxygen is 99. Take a deep breath. I know you used the machine today.
Just over an hour ago.
Yeah. So we want to get that. Oh, wow. 96 after taking the breathing treatment. That's cool. Okay, so we're going to do that infusion over 10-15 minutes. It doesn't take too long to get it in there. And it's really, I mean, I've seen so many patients with great, responses, especially if, it's the second week we're having a little bit of reaction. So tell me what's your symptoms right now.
Last night I started feeling heaviness in my right lower lung area.
Yeah.
And again this morning was feeling some tightness and a little bit of pain actually.
A little of pain.
Yeah. But just still a lot of fatigue.
Yes.
Not a lot of coughing.
To hold it for yes.
Not a lot of coughing, no fever though, just fatigue.
Well, we have to clarify this because all people think that COVID has fever.
Yeah.
It's barely 99 if anything.
Yeah.
So I just want to clarify, some people would have the fever that would differentiate the flu from COVID.
Yeah.
So I tell people, it doesn't mean, if you don't have fever, that doesn't mean that it's okay, that it's not COVID.
Yeah. The highest temperature I had was 100.7. That was
Right.
the highest temp I had.
Cool.
So I was about 5 days out with having COVID when I started to develop my chest pain in the back of my lungs and just chest pain, and it just hurt to breathe, and I was a little short of breath as well, and so that alarmed me terribly. I did have a fever for just half a day. It was about 100.7.
That's because of the flu.
That was because of the
Fever
flu.
is not a character of COVID at all.
Yeah.
We need to clarify this for our patients.
Yeah.
Maybe 99 is for COVID.
And this all happened during Christmas on the 17th, 18th. My children were supposed to come visit me on the 20th.
Yeah.
So I had to cancel all those plans, obviously, and just recover at home during Christmas.
Yes, alone.
So
we have the decorations the day I came and infused you.
So 5 days later, I was, like I said, short of breath. I couldn't, I was having difficulty breathing, and I did call Dr. Barr.
And we were following every day, calling.
Yeah, and Dr.
checking,
Barr called me every day, sometimes twice a day, to see how I was doing, and that was very reassuring to me because, I needed that. I needed someone to just be there for me, and Dr. Barr was there. She called me all the time, and I'm very grateful for that.
Oh, thank you.
And so she came 5 days later and gave me...
We discussed more treatments, yeah.
We did discuss more treatments, and after day 5, I decided to go through with the therapeutics, and that's when she gave me the therapeutics via IV.
We did vitamins, we did glutathione for inflammation.
Vitamins, glutathione,
exosomes.
exosomes. We did everything that Dr. Barr suggested. I did because I wanted to just jump on the gun and just attack it early, basically.
I remember it was raining these days.
And it was raining that day, and she was
balcony.
giving me the therapeutics in the rain, and I had my pajamas on, and I was all covered up. Yes, and so she ended up coming out to my house, gave me the therapeutics, and about 5 days later, I did start to feel better. Better that, but the pain was gone in my chest. I had a lot more energy. I didn't feel short of breath anymore. And 2 or 3 weeks later, I felt better. I went back to work after 2.5 weeks. I started playing tennis after 3 weeks. My energy went through the roof. My mental clarity was...
So a lot of people complain about foggy, very typical with COVID,
yeah, and to this day,
forgetful,
8 weeks
and
out,
low energy. Yes,
8 weeks out, I still feel great. I'm feeling wonderful. I feel like I have a lot of energy.
So these infusions do tend to do that.
Yeah,
they give you a lot of energy.
They give me a lot,
and you researched that on our website.
I did. I researched her.
You're a nurse. Yeah.
I'm a nurse, and I did all the research, and yeah, I feel so much better after 8 weeks.
Yeah.
I feel like actually a new person, to be honest with you.
Amazing.
Yeah. And I'm now working with Dr. Barr, helping COVID patients, giving them their therapeutics and their exosomes.
So you loved it, and now you joined the team.
I joined the team, yes.
Thank you, and welcome aboard.
Thank you.
Thank you.